Sepsis is a global healthcare threat that's more common than heart attacks and claims more lives than cancer. It can occur in any patient at any time and in any part of the body. It can lead to tissue damage, organ failure, and death if it isn't quickly diagnosed and treated. Over 1,665,000 cases of sepsis are reported in the United States each year, with a mortality rate of up to 50% in people over age 65. Vulnerable groups include newborns, small children, and the elderly. Another high-risk group includes people with chronic diseases, such as diabetes, cancer, AIDS, kidney or liver disease. Pregnant women and those with severe burns or physical injuries also have an increased risk of developing sepsis. The CDC is working to increase awareness to healthcare providers and hospitals. Glenwood Regional Medical Center has adopted the new CDC guidelines by establishing new quick response protocols designed to help our healthcare providers quickly recognize, diagnose, and treat patients whose lives are threatened by sepsis. Every patient who receives care in our hospital can be screened for sepsis. If they meet the nationally recognized criteria for possible sepsis, they can then be treated with speed and excellence. In this video, we'll go through the steps of screening, diagnosing, and treating a patient for sepsis. We'll begin with our patient's triage encounter in the emergency room, followed by his emergency room visit, and finally his admittance to the intensive care unit. While you're watching, take note of the many Glenwood healthcare providers who are involved in sepsis recognition and treatment. Each provider plays a valuable and essential role in combating this high mortality condition. Let's get started. Our patient has been feeling very ill and has come to the Glenwood emergency room for treatment. While he is seated in the triage room, the triage nurse begins a standard assessment. He complains of a fever, cough, and uncommon weakness. The nurse then takes his vital signs that reflect a temperature of 101 degrees, a heart rate of 95, a breathing rate of 22 times per minute, and a low blood pressure reading of 104/50. The triage nurse immediately recognizes several signs of sepsis: tachycardia, fever, tachypnea, and low blood pressure. His cough indicates a possible pulmonary infection. The Glenwood triage nurse accompanies the patient to the treatment room and notifies the ER nurse that he has several sepsis indicators. The ER nurse further assesses our patient to check for an altered mental state and any skin mottling. She also rechecks his blood pressure. An IV is then started in the patient. The phlebotomist steps in to draw a complete blood count with differential, lactic acid, comprehensive metabolic panel, PT-INR, and blood cultures. A urinalysis and urine culture are also obtained. As the patient is having blood drawn, the emergency room nurse notifies the doctor that the patient has possible sepsis. The doctor examines the patient and explains to him what the evaluation plans are and answers his questions. The X-ray technician then comes in to take a chest X-ray of our patient. With a history of cough, he more than likely has a pulmonary infection. When the stat laboratory has resulted, the physician reviews them. The patient's white blood cell count is elevated at 14, and his serum lactate level is highly suspicious of septic shock. His chest X-ray shows a pneumonia in his right lower lung fields. The emergency room doctor makes a diagnosis of severe sepsis with hypotension due to pneumonia. The ER nurse then begins a fluid bolus on the patient of 30 milliliters per kilogram. The bolus is given regardless of any comorbid illnesses, including congestive heart failure. She also begins empiric antibiotics as ordered by the ER doctor. All of these steps and protocols must happen within the first 3 hours of our patient's initial presentation to the triage nurse. A second lactic acid level is ordered to be drawn within 3 hours of the initial presentation to triage. With the sepsis protocol in progress, our patient is now transported to the intensive care unit. The ICU nurse, together with nurse practitioners, hospitalists, or critical care doctors, reassess the patient. His vital signs, skin condition, cardiopulmonary exam, and capillary refill are checked. After the fluid bolus is infused, the ICU nurse finds the blood pressure is still low, with a mean arterial pressure of less than 65. She contacts the physician, who gives her an order for a Levophed IV to maintain a mean arterial pressure greater than 65. Within the 3-hour protocol window, our phlebotomist is back to draw a second lactic acid level. Our patient has been screened, diagnosed, treated, and reassessed, with further treatment started. All of this has occurred within the prescribed 3-hour time frame. Together, our Glenwood Healthcare team will continue to set the standard of excellence in the promotion of health and well-being among members of our community. And together, we are now asked to stand as a united front to help fight sepsis and improve early recognition. Because together, we can save lives.